them 15 seconds to generate this information. Selection of patients with any number of complex clinical criteria for a clinical trial takes exactly a few seconds. It used to take months for them to group patients with complex conditions and select patients for a clinical trial. Going through all those manual records, I'm sure all of you will know the complexities of that. Today, in a minute, they can get their patients selected for clinical trials. They have this pattern recognition system. It is admittedly independent of a data warehouse. It has certain limitations, but today they can look for basic patterns in clinical data, and imagine they now have 500,000 patient records in electronic format. Imagine the potential for them in terms of their research going forward. Yeah, I'm running through just a couple of minutes. Clinical values, there's no reason I said earlier why a patient can't be a stakeholder in this whole process. He's the most important person in this entire chain. So can we give him access to how he's doing vis-a-vis other patients who had similar conditions? Can we inform him of what problems he's likely to face over the next 2 years? Why not? The clinical analytics platform generally will do all these things pretty easily. As I said earlier, clinical decision support system is the heart of a clinical analytics platform. If you can put in your treatment protocols, you can put in your complex algorithms, you can put in any rule engine-based systems into these and use these rules to deliver outputs across different groups. So it's very important to note that using a DSS as part of a clinical analytics platform gives the application the additional intelligence or brain. Just a few case studies. We're doing work now in China on a clinical decision support system platform, and we're doing work in telepsychiatry. We built one of the country's first telepsychiatry applications for PGI in Chandigarh, and this is going to be scaled up across the country. So in a variety of ways, intelligent systems are changing the way healthcare is conventionally delivered. This is just a slide just to show you one very important part. We've got the data warehouse, which everybody is talking about, and they'll do that. But the two most important parts there are the data marts, which are essentially different applications for different stakeholders. So the team that's doing the genomics will want something else. The team that's doing disease surveillance will want something else. The team that's doing clinical analytics will want something else. And those need to be built in for each individual stakeholder. I have just two more slides. The big problem, adoption. Why is this technology, which is not already available, being adopted on a mass scale? There are a number of reasons, and for paucity of time, I'll just say that what needs to be done, we need to have a resource for clinical analytics in each large hospital. We need to have a clinical analytics department within the government, a state data resource center, which, for instance, Tamil Nadu is setting up. We need to have more awareness among the various stakeholders about the benefits, and of course, we need to publicize the benefits and the outcome. To summarize, intelligent clinical systems are already here. We need to address adoption issues. These applications have the power to change the healthcare delivery paradigm. It needs all our support, and it certainly needs the support of the state with a policy and a mandate. Thank you very much.
Thank you so much, Mr. Raman. We also have with us today Mr. R.S. Kaushik, who is the GM of the Telecommunications Consultancy India Limited, also known as TCIL, and has been working in the field of telemedicine for the last 6 years. After completing his post-graduation in computer science from the USSR, he returned to India and started work with CSIR, moved on to the National Informatics Center, and is currently with TCIL. He's worked on projects with the ADB, the UN, the Government of India, as well as international projects. And he's currently involved in a Pan-African e-network project for telemedicine and teleeducation by the Government of India. Mr. Kaushik, everyone.
Good afternoon to everybody. Kaushik from TCI. So I would like just to run MEA-supported e-health initiatives. To start with, I'll just give you some background about TCIL, Telecommunication Consultants India Limited. TCL basically is a Government of India enterprise, and it was set up in 1978 by Department of Telecommunication to share Indian expertise in all fields of telecommunications globally. It is an ISO 9001-2000 certified. TCL is a profit-making Indian MNC having operated in more than 60 countries across the globe, and out of which 49 countries in Africa. It provides consultancy, turnkey project execution services from concept to commissioning in the fields of telecommunication, IT, and civil and architecture. And the consistent track record of turnover for last financial year was $411 million. Then ranges of services in telecom, IT, and civil works, consultancy, feasibility studies, design, engineering, project supervision, network planning and development, operations and maintenance, turnkey project implementation, training, managerial support, and manpower support. Then different areas of specializations like access networks, whether it is wireline or wireless, then transmission systems, OFC, microwave, satellite, switching systems, mobile networks, IT and IT-enabled services, IP-based networks, implementing e-governance infrastructure, then design and construction of intelligent buildings, architecture, design and civil works, cyber parks, OPGW power line projects. Then these are some of the countries where TCL is either existing, is currently present. Then major projects overseas, fiber to home project for MOC Kuwait, then Pan-African e-network project for tele-education, telemedicine and VVIP connectivity covering 54 countries of Africa. Then building 500-kilometer OFC network for Myanmar, then supply installation of satellite hub and 500 VSATs in Nepal, development of ICT security and audit policy for Ethiopia, turnkey implementation of telemedicine network in SAARC member countries for Ministry of External Affairs, then setting up of ICT departments for Sudan, project management consultancy for Algeria, setting up of cyber park, then projects within India, National Internet Backbone, Phase 3 of BSNL, then turnkey implementation of telecom, IT and networking projects for Commonwealth Games for Delhi 2010, consultancy for implementing e-governance projects, that is statewide networks for 5 states, then consultancy for modernization of communication network for Jharkhand Police, then setting up of virtual university for University of Madras, then vessel traffic services, and then consultancy services for Sardar Sarovar Canal Automation Project, consultancy for railways, that is Railtel, then technical and financial consultancy services for optical fiber network augmentation in West Bengal, implementation of OncoNet for Ministry of Health and Family Welfare. So coming back to the MEA initiatives, let me just go back to the telemedicine, a journal overview about it, that telemedicine, a distant care. Basically, telemedicine, as per our understanding, is the use of electronic communication and information technologies to provide health care when distance separates the medical professionals from the patients. The basic objective is to provide affordable health care facilities to rural population through specialist consultation and reliable communication links. So this is a pictorial diagram that a patient and a doctor examines the patient, and the EMR is generated and it is transmitted to the specialist at specialized hospital, and the advice is sent by the specialist doctor to the patient and doctor. And the major application of telemedicine technology, like teleconsultation, telediagnosis, teletreatment, where patient with local doctor consults the specialist for treatment, then tele-education, tele-training, that is continuing medical education training for doctors and paramedics, then tele-monitoring, tele-support for emergency care and disaster management. Then we talk about the objectives of telemedicine, selecting telemedicine equipment to meet the medical needs of the local communities, determining the factors involved in transmission of medical data to adapt to the existing connectivity and other facilities to select an appropriate communication technology for delivery of patient data to the specialist and develop the methods towards a sustainable telemedicine technology for safe and reliable, cost-effective operations, to evaluate the centers to find it if IT and telemedicine services can improve the quality of care and access to health care. Then key benefits of telemedicine. The advances in medical science, biomedical engineering together with ICT have led to the development of telemedicine solution. This has contributed to providing affordable healthcare facilities to rural population. Adaptation of telemedicine technology is one of the best options to deliver healthcare for rural population. Use of ICT between specialist doctors and patients ensures improved healthcare facilities. The overall costs of providing treatment through telemedicine solutions are less than the cost by conventional methods. The continuing medical education CME system offers a suitable platform for practicing doctors to seek guidance and to be abreast of the latest developments from experts in their respective fields. Then type of communication, it can be a real-time, that is in interactive mode, where using video conferencing type of setup, doctors at both the ends share, doctors as well as patients share the information and share maybe the patient details with each other. And the other way could be a store and forward type of communication, wherein digitized details of patients are stored and forwarded to the specialized doctor, and specialized doctor sends back the advice. Then telemedicine major components, as we see, the modality is basically medical equipments, telemedicine hardware, software, CME hardware. This is from the capex cost point of view. Then from recurring point of view, communication link and operation maintenance cost.